Hi, my name is Emily,
I'm Makayla.
and we are both family nurse practitioner students at the University of St. Francis. And we're just going to briefly go over with you a pamphlet that we developed together. This pamphlet looks just like this, and you guys, I'm sure, will have access to this. So what this pamphlet goes over is sudden cardiac death.
So when we talk about sudden cardiac death and what is it, it's an unexpected loss of heart function resulting in loss of consciousness, collapse, and then eventually death in otherwise healthy children. It can affect children of all ages, and it occurs during exercise, during rest, and even during sleep.
So after we kind of went over, what is sudden cardiac death, we're going to go to the next section down here, which just goes over who's at risk for sudden cardiac death. So children are at risk for having sudden cardiac death, and the children who are most at risk are the kids who have problems with their heart muscles, the way their heart is structured. Certain diseases put them at higher risk. So ones that have kidney disease or thyroid disease, epilepsy, and also if you know any child that is taking a stimulant, some type of form of stimulant medication, this also puts them at risk. And then you'll greatly realize when you're going through this pamphlet how big family history puts them at risk. So as you can see in the bullet points for under who's at risk, children with family members who have died unexpectedly, less than the age of 50, those that have family members with heart problems, that could be structural heart problems or electrical problems in their heart, and then as well with family members who also have epilepsy or muscular dystrophy. Those are going to increase that child's risk for developing sudden cardiac death. And then you can also see, we just put a statistic there, that about 4.5% of children affected by sudden cardiac death does have that positive family history, and it's usually the first degree family history.
So when we're looking at signs and symptoms with children that we're looking at for sudden cardiac arrest, really there may be no warning signs. Signs and symptoms that could indicate a problem that may lead to sudden cardiac arrest would include children who experience chest pain, feelings of chest pressure or tightness, dizziness or lightheadedness, fainting, that feeling of racing heart or skipping beats, increased tiredness or fatigue, especially with playing. If you see your child can't play or keep up with the other children that they're playing with, shortness of breath, seizures, and then you'll hear your family doctor talk about maybe abnormal heart sounds.
So after we kind of just briefly went over, some signs and symptoms, right below that, we're going to go into how can this be caught. So basically the biggest thing with this is taking and encouraging that children are going to their yearly well child checks, and then they're having sports physicals completed. These are the way the healthcare provider can find some of these symptoms of listening and hearing some abnormal heart sounds, and the examination can clue in the provider to maybe order some extra tests that will look at the heart structure, electrical impulses of the heart, that can see if the child has any developmental problems within their heart that's going to put them at risk for sudden cardiac death. You can see below there that there's, like we said, there's specific heart problems that are increasing their risk for sudden cardiac death, and there's many different tests that your doctor could order. And just one that we put on there briefly was an ECG. And the ECG is basically looking at the electrical activity of a child's heart. So again, these will all be ordered based on your doctor's preference. If they see any signs and symptoms or find anything at that physical, the sports physical, or any well child checks. That's why it's really important that you encourage these children to have those done and completed.
If the child's physician or nurse practitioner happens to find an abnormality, either through listening, through tests like ECG or echocardiogram, there are different treatments depending on whatever cardiac diagnosis they receive. Treatments could include things like medications, special diets, or certain lifestyle changes, and even special medical devices like an implanted cardiac defibrillator. So it's really very dependent on what the child may or may not have.
Yep. And so again, just like Makayla went over, we went over just the treatments right up here, and then down here, you can see we're going to go over what can you do to prevent sudden cardiac death. So this kind of ties in with how can it be caught. Again, encouraging the child and their parents to schedule and attend all of their well child checks with their pediatrician, making sure that they're getting those pre-certification sports physicals. Those are very, very, very important. And then stressing to the family the importance of them knowing their family history, their cardiac family history, and talking about this history with their provider. And then encouraging, life support training and coaches and community members. So learning CPR, knowing how to do, those life-saving measures if something were to happen out in the community. And then encouraging the placement of an AED in areas where children are going to be playing sports and being active is really important as well.
Which we do have pictured here, an AED, just in case, caregivers don't know exactly what that looks like or have never seen one before. Just knowing the patches and the placement, AEDs often just talk you through the exact steps of what to do, so any lay person can do it.
Then we'll move on to when should you go ahead and contact your provider then?
So parents and caregivers should contact their healthcare provider if the child experiences any kind of worrisome symptoms such as chest pain or shortness of breath, fainting spells or racing heartbeats, anything that we had listed previously. If caregivers find out about some new family history or new heart problems or an unexplained death in a family member, those should be brought to the healthcare provider right away. And then each year, the child should go to their provider for a well child visit, and then participate in any kind of pre-participation sports physicals with each season.
Yep. And then just kind of in conclusion, again, just summing up everything that we just kind of went over, sudden cardiac death is rare, but it's very, very devastating for the child, the family, the community, everyone. So, just having that conversation with family and with the children, understanding who's at increased risk and encouraging them to, talk about those risks with their primary healthcare provider and going to those well child checks when they're supposed to, having those sports physicals when they're supposed to, and really learning, how to use an AED so you're prepared in those situations, and advocating to have those AEDs placed in those situations, those sports places where those kids are going to be being active. That's overall going to be, truly one of the most important things. So that kind of just went over, in the back you'll see some references that we used to develop this pamphlet. But this is definitely available for you guys to be able to use out in the community.
And then just in case some of the caregivers come back with questions for you guys as you're going over these pamphlets, some people may wonder what's the difference between sudden cardiac death and SIDS, so sudden infant death syndrome. Sudden infant death syndrome is typically an unexplained death that occurs during sleep in infants less than a year old, whereas sudden cardiac death usually is over that 12-month limit and has a positive cardiac relation. As parents may or may not research this after being talked to about the pamphlet, they will see that there is a slightly higher risk for sudden cardiac death in athletes. This does not mean that parents should discourage their kids from participating in sports and outdoor play. It really does mean that they need to go and talk to their provider and go through their yearly well child checks to make sure that there isn't an issue that needs to be addressed. But even most kids with cardiac diagnoses can and should participate fully in sports and outdoor play.
Yep. Just the importance of making sure you're getting those well child checks and those sports physicals completed, and then talking about those risks with your provider, and then together as a team, you guys can develop if those extra tests are needed to see if this child is at risk and to ultimately help prevent sudden cardiac death. Thank you so much.
Thank you.